Jamf Healthcare Solutions. What's new for patients and providers? Welcome. Jamf has been in the healthcare space since 2015, releasing our first healthcare dedicated solution in 2017 and now again in 2020, which you'll learn more about today. Joining me is Tyler Kilberry, Victoria Smith, and Tim Knox. For our agenda, we'll cover 3 specific use cases for how Jamf has been supporting healthcare environments historically and now within this global pandemic. The 3 key use cases that we'll discuss today are patient bedside experience with our EMR integration or HealthcareListener, clinical communications supporting our strategic partners, and telehealth, which has evolved since COVID-19. Let's focus in on HealthcareListener. For those who have seen HealthcareListener presented on in the past, can attest that the solution's interface has not changed much. However, what has evolved is the way HealthcareListener is being utilized. With Jamf Setup and Reset incorporated into these specialized environments, alongside Apple TV, the patient experience has adapted dramatically. I can truly emphasize the key goal of supporting patients to have both a positive experience and engagement in care as it relates to the tools in their environment. I myself used to provide care at the bedside for nearly 8 years. Throughout that time, I have seen firsthand the benefits of distraction therapy, care plan engagement, and overall empowerment when given the ability to access the resources. Giving patients access like they've never had before has transformed the standard experience within the unfortunate time one has to spend in the hospital to a more or tailored experience. For example, in a pediatric unit, we have seen and helped adapt Jamf Setup for assisting age-based configuration profiles that meet the needs for that specific environment, in addition to adding specific information for the specialties within that pediatric environment. You are also empowering the parent to add restrictions based on the age, which can also be pre-configured by your organization as well. To take this example a step further, with highlighting the addition of Apple TVs into the child's room, the family is able to securely screenplay content in the room for more robust care discussions, like explaining procedures, viewing rehabilitation or educational content, and delivering a critical yet simple solution for distraction therapy. Your organization has the ability to customize your Apple ecosystem to meet your specific needs. Please welcome Tim to introduce himself and dive into the tech powering these solutions. Tim?
Hi, thank you for that, Kelly. I'm Tim Knox. I am the Business Development and Enablement Systems Engineer at Jamf, focused on healthcare and other vertical solutions, which is quite a mouthful. But one of the greatest things I've been able to see in the last few years working the healthcare beat is seeing what our community has done with the tools we have. My job is to live in a space and find the gaps that exist between what people are asking for and what's possible. And it all started at the bedside. Giving patients some distraction or education can make a huge difference in what they experience in that bed. We want to help provide that without adding any extra work to the staff at the hospital. So let's start at the beginning. This may be a review for some people, but I think it's important that we talk about the foundation before we talk about what's built on top of it. This interface listens for commands from the EMR. And as long as the EMR sends standard HL7 or ADT messages, we don't care what brand you use. We grab a bunch of stuff, leaving out any PII or PHI, and we can take action on what is sent. In this example, the nurse will discharge the patient in the exact same way they would any other patient, and a wipe command is sent to the Apple TV in that room. Now, let's look at the screen in a little bit more detail. Starting at the top, you can see that you have the ability to get notifications via email. That means you can select either messages on failed commands, commands sent to unsupported devices, or both. It's a great way to keep a little bit ahead of any potential issues that may come up. And moving down a little bit from there, we've selected tvOS and wipe device for this rule. And we can also send lock, unlock, clear passcode, and lost mode on iOS devices. And we listen for admit, transfer, and discharge. And the field mapping is where it gets a little interesting. The PV133 section down at the bottom is the room the patient is in. Since we can match that section with the room inventory field in Jamf, we don't need to know the patient's name. We just need to know where they are. And the neat thing about Apple TVs is that as long as it's plugged into an Ethernet cable, it'll go through the entire enrollment, activation, and deployment of the apps and restrictions that you want on that device without needing to touch it at all. And this gives you the freedom to let that patient log into their own apps and pick up the shows they were watching as if they were on their own couch at home. And when they're discharged, the apps and their credentials are wiped from the device. And we can even tie an iPad at the bedside to that Apple TV so they aren't accidentally airplaying to the wrong room or needing a passcode or any of that. You just click AirPlay and it's connected. So if you're an admin, you may want to run some tests on the devices without sending an actual discharge message to the device itself. So, and as some of you know, getting a hold of your interface team whenever you want to run a test on a workflow would be a lot smoother if you could just remove that step. So, check this out. We built a GUI for admins to use to help validate the work that they're doing. You can use your Jamf credentials on the site, which then pulls up a list of commands you have in your instance. It is not talking your EMR, just the Jamf Pro instance and the HealthcareListener itself. It acts as a kind of faked EMR HL7 to test and validate your flows. You can even type in the room you want to send the AO command to, and it will send a faked command to Jamf Pro, which will then take the MDM action on the device. But what's really cool is that it will act back the message that you sent and give you a full readout on the ADT feed that you sent. You can see here that we sent an AO1 command and it acted back an AO1 response. And you should see the MDM action on the device itself. And unlike the first command I showed with the HL7, with the HealthcareListener in Jamf Pro, this one's going to an iPad. So let's take a look at what that can look like. This is an example of what someone could see on their iPad at the bedside. And one of the really cool things I've seen that Kelly mentioned is giving the patient or nurse the ability to choose the best and most applicable experience for them from the device using Jamf Setup. No need to contact IT to make it do something different. And it's not just patients that are using the iOS devices. We're going to hear from Tyler next about what the nurses and clinicians are doing and how the admins are deploying them. Tyler?
Thank you, Tim. In the last year, working with our hospitals on their clinical communications deployments, it's been exciting to see how they've ensured success of these deployments as they scale these out across their organizations and clinicians. In working with UCSD, we asked the question, how are you able to get widespread adoption so quickly? They're at the point where they're currently enrolling about 70 devices at a time in batches. They shared that critical to their strategy was having a clear vision and to have leadership buy-in in the project. When they thought about adding a new tool and workflow widespread to their clinicians, having a clear picture, an end goal, and having the buy-in of leadership helped them reduce burnout and helped with clinician adoption. As they rolled this out, they took into account the feedback from staff on what would make the device most useful, what additional applications were needed, how could they ideally configure these devices. By ensuring they were enabling the clinicians as much as possible with the device and taking their feedback into account, they found the adoption was higher. In working with the team over at UC Health, Kyle Toberin and Philip Dameron, they shared some workflows that help save them time and are great lessons for any clinical communications rollout. First, identify all the desires that you have for the solution. While it might seem like these would all relate to the success for your clinicians and their communication, in the case of UC Health, they identified having a clear inventory, segmented out by building, region, and with a total global number to help save time in reporting. Additionally, they wanted to make sure that their clinical communications project had fluidity with their other projects, meaning they wanted to be able to see their devices as flexible. If they no longer needed a device for their clinicians, they could easily move this over to being used at the bedside by patients or as a translation device. One of my favorite things that they did was to create a restricted pre-stage for these deployments to help make larger batch deployments easier for their teams and to ensure there were no issues prior to assigning the devices to the end user. In their workflow, the device would come in from their reseller and was assigned to their Apple Business Manager account, and from there automatically enrolled into Jamf. From there, assigned to a restricted pre-stage. From the restricted pre-stage, their team assigns to the appropriate grouping and then deploys those out in batches. Depending on the proximity and location, they either hand them out in person or they ship them. And now back to Tim to talk about some of the interesting things we've been doing on the technical side of clinical communications.
Awesome. Thank you, Tyler. Navigating the landscape of a deployment like that is really interesting. And a lot of those techniques that Tyler talked about is what Jamf is really, really good at. But I'd like to talk about the flexibility of the devices for a moment. When COVID hit in March, we saw a lot of change happen really fast. We heard from dozens of health organizations asking how to move spare iPads or iPads that were meant for one thing and getting re-provisioned for something else. Sometimes that meant running them through Configurator 2 to add them to Apple Business Manager for that location. But sometimes it meant that we could utilize Jamf Setup for that job. Now, as a reminder, we introduced Jamf Setup 2 years ago at JNUC in Minneapolis. It came directly out of conversations with nurses and clinicians to help with patients at the bedside, like Kelly talked about at the beginning. It uses a custom inventory field called an extension attribute. And Jamf Setup gets deployed to the device, and the user can make a selection which can change the attribute to and move which smart group bucket it's in. This means we could nab some older or unused or underused devices, deliver setup to them, and let the staff on the floor decide the best use for that device on that day. Maybe it's translations now, apps that are needed. Maybe it's something else that we're going to talk about that came out of the work we did back in March that we're going to cover a little bit later. The point is, we can really easily change what the device's purpose is without needing to contact IT, and it can be done mid-shift. We've made some small changes to setup in the last few years. And I've lost my second screen, so I'm just going to reconnect that. Bear with me for a moment. Live events are very exciting. There we are. Right, so we've made some changes to setup in the last couple of years. The most recent is the ability to use token-based OAuth instead of a username and password, which used to be sent in the clear. We made a restricted API-only account for that event. But to be able to use OAuth and omit the username and password completely, way more secure and way easier for the admins to use. And this is out today and can be used can be deployed to your existing fleet with a simple update and 3 new keys in the managed app config section, which I'm showing now. You flip the legacy username and password off, add the OAuth and reinstall OAuth, and you're in business. It's really as simple as that. And then you can delete that API account. And one more thing you can do that we changed is to swap out the Jamf Pro URL with that $JPS _ URL variable. So you aren't exposing your Jamf Pro URL in clear text either. Small, but really useful iterations for Jamf Setup. And I am very excited to talk about version 3 when we're able to sometime in the future. And one of the hiccups that comes from moving devices around with setup, or heck, just a hiccup of having mobile devices at all, is that they're mobile. And one thing we hear over and over again is, how do we know what device this is without relying on that tiny serial number printed on the back, which is probably covered by a sled anyway? And we love the fact that you can put a message on the lock screen, but the type is too small. Can you make that bigger? And USFC, Benioff, UCSF was one of those customers, and they came along at exactly the right time to help us make that happen. Now, I want to emphasize that this is not a product. but it uses tools that are publicly available. I've lost connection to my second screen again. So we are going to just not use that second screen at all. And we're just going to fake it. Next. There we are. So I want to stress that this is not a product, but it uses tools that are publicly available. And with a little coding or a quick call to your friendly neighborhood healthcare team at Jamf, something like this can be in your environment. It uses Java, which is a Jamf webhook server, and Python image library. It can be used in conjunction with Setup to show inventory fields of your choice, like this, on the lock screen of your device, along with a wallpaper of your choice. Now, this version that UCSF Benioff is currently in a proof of concept with was written by one of our implementation engineers and my BFF for life, Chris Ball. And he goes into great detail on this specific thing in our advanced Jamf Setup presentation elsewhere in the JNUC, and you should definitely check that out. And speaking of our implementation engineering team, I'd like to pass it over to Vix next.
Thanks, Tim. I'm sure that you've all seen our keynote from Oxford Health. Well, I'm here to tell you firsthand how virtual visits was a game changer. When COVID hit, I was working for Oxford Health NHS Foundation Trust in the UK. And as I'm sure you can imagine, the impact was massive. Being a mental health trust, patient wellbeing is most important. And it became apparent very quickly that we needed a solution to enable our patients to contact their loved ones and reduce social isolation. Shortly after that realisation, it was echoed by the UK government when they released a statement saying that people were in a hospital and unable to see the families, and that obviously there was a massive empathy for them. The team at Jamf contacted us and demoed virtual visits, and we knew that this could work for us. It removed the necessity for individual logins, and this obviously removed the concern around information governance. All of this whilst empowering our patients to maintain their own well-being. Mitigating the risk of infection was just as important, and the best practice would be to provide one iPad per bed in the community hospitals. Well, that's exactly what our board did. They removed any concerns about infection, and they did actually put out one iPad per bed. It was unprecedented, and it was an amazing thing to see. We worked quickly with Jamf and Apple to deploy those iPads, and we were able to provide that very much needed contact between patients and their loved ones. As you heard from Holly earlier in the keynote, we had great feedback that patients and staff were using virtual visits with ease. I mean, what a great testament to the fact that we'd made the right decision for the trust. If you haven't already checked out the keynote, then please do. It is well worth a watch. Anyway, I'm sure you've heard enough from me. And Tim, can we show everyone how virtual visits works?
Yeah, absolutely. We totally can. I personally love hearing stories from people who are actually using the devices in their environments. I remember being on a call in early March with an existing customer that had reached out trying to figure out how to deploy a few hundred pre-made MS Teams accounts so their patients could have virtual calls with their families. In fact, me and the healthcare team had just returned from visiting their hospital to see how things were going and make sure we were keeping up with their needs and chat with them. And I went back to our team after that call and found that almost at the exact same time, there were other asks from all over the world coming in asking for something new. And our friends who built the HealthcareListener, Jamf Setup, Jamf Reset, the wallpaper workflow, and the HealthcareListener tester got together and built something very quickly. And I was able to test this out with my family who live in Idaho and Washington from here in Minnesota. And its early stages looked a little bit differently, but the core concepts have stayed the same. I clicked the Create New Link button at the top, and then sent the invitation out to my family. My mother joined on her Android, and after figuring out which camera to look into, we were able to talk. My father joined on his PC. My brother and sister joined on their iPhones. Now, suddenly, with 3 taps, I was able to see and talk to my whole family. And putting these in patients' hands have been some of the most rewarding work I've done with my time at Jamf. And here's how it actually works. So starting at the beginning, starting at scratch, the iPad will go through its initial boot and then get enrolled in Jamf via the automated device enrollment through Apple Business Manager or Apple School Manager. Our virtual visits, Jamf will deploy all settings, security, and wallpaper to the device, and our virtual visits service will deliver the keys to the device once it falls into the proper smart group. The web app then gets deployed after all the extension attributes are populated with the necessary information. It's all hostless and doesn't require any logins from the patient or the family. So you, as the patient or clinician, if the patient is incapacitated in some way, type in an email and click the Start Meeting button. And as we are fond of saying here, there is no step 3. Just like that. And if these are roaming devices, it can be passed to the next patient who can clear out the previous link by creating a new link and sending a new email and connecting to whomever they want to connect with. Alternatively, if the devices live in the room, the same link can be used over and over again by the patient in that room. And after the patient is transferred out or discharged, the healthcare listener will wipe the device, which will reset all the extension attributes and populate them with fresh links once activated. Or you can use Jamf Reset to wipe the device between use if you have any other PHI or PII on the device. And one brand new addition as of September, we can now use SMS as well, which is super awesome and gives a whole new level of flexibility to use virtual visits. So the patient can go about their day during their stay, communicate with friends and families using virtual visits. The clinicians can use their devices to do rounding and secure text on devices that they'll actually like. At the end of the patient's stay, the nurse will discharge the patient and the healthcare listener will hear that command and wipe the device in the room. When it comes back online, it will deploy a new link and the devices to the device, and you can send out a new invitation to the patient's family and destroy the previous link. And now you have a complete environment where you can deploy apps and security to both patients and clinicians' devices. You can ensure a secure, programmatic wipe to the patient's devices without impacting the nurse's known workflow. You can allow for a seamless, simple, passwordless communication to friends and families from a managed device. And virtual visits specifically is free through the end of the year. The implementation, the time with our services team, the seats, the standing up of the Jamf Pro server if you're not a current customer, all of that work, all of that time, and all of that power that you give to your patients to be able to contact their family, totally free until the end of the year. Please reach out to the healthcare team and let us help you put this in your environment. Thank you very much for listening, and don't hesitate to reach out to any of us if you want to talk about any of the things you heard about today. Thanks for your time.